I think the high sensitivity troponins has actually brought about 3 major achievements. And the first thing is that when the high sensitivity troponins came, for the first time we were able to actually use the 99th percentile as cutoff for diagnosing myocardial infarction. Before that, we usually needed to use the concentration where the assays had 10% CV because we could not accurately measure the 99th percentile. So that was the first achievement. This has been important for us to standardize the diagnosis of myocardial infarction around the world, so that when everybody uses the 99th percentile for their assay, there will be a much larger equality in the diagnostics. And that is a good thing for patients, because you do not want your diagnosis to be dependent on the hospital or the assay they use, right? So that's the first achievement. The second achievement is that before the high sensitivity troponins came, we had there were a lot of data indicating that there could be a long-term prognostic information associated with measuring troponins. But then, when the high sensitivity troponins came, we could measure very low concentration, and it was actually very easy to show that. It has been shown, I think, in a lot of very large studies, important studies, in different kind of cohorts like general population, acute coronary syndrome, chest pain, and also other conditions, that your baseline concentration of troponins will actually be able to tell us a lot about your long-term prognosis and your long-term risk of cardiovascular disease and outcomes. We don't know exactly how to use this information yet, but I think future research will show that to be able to identify the high-risk patients, we will also be able to treat them and prevent later disease. That will be largely a consequence of the ability to measure low concentrations of troponins. Lastly, and of course this is a very important achievement, is that after the high sensitivity troponin came and we could measure these low concentrations, we are actually able to identify already in the emergency department patients with low or high risk of myocardial infarction. We can use that information to improve the patient flow through the emergency department, so those with a high risk can go directly to the cardiac ward and get treatment, and those with a low risk, they can be investigated for other conditions, or very often they can just be discharged and go home, if you can say that, be able to show with a very high probability that they do not have risk of myocardial infarction. So I think those are the major achievements after developing the high sensitivity troponins, and I think this is, it's been a major leap forward for the whole cardiac marker field, and also for cardiology itself, and major improvements for patient care.